Good morning, happy people. Hope you always in a good condition. First of all, let me introduce myself. My name is Putu Hindiani Putri, but you can call me Hindi. 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 As we know that the world is currently facing an epidemic that attacks everyone in the world. The COVID-19 outbreak that first appeared in Wuhan, China. This outbreak is caused by a virus, namely the coronavirus. This virus can spread usually through the respiratory system. Many people who have died because of this virus. In Indonesia, this virus appeared in early March 2020, and until now, there have been many records of cases of the coronavirus. Ranging from people infected with the coronavirus, people who have recovered, to record of death due to the coronavirus. Do you know what the coronavirus is? How do you get it? What are the symptoms? Or have you been infected with the coronavirus? As not longer, let's take a look at my presentation today about COVID-19. COVID-19. Coronavirus are a large family of viruses that cause disease in humans and animals. In humans, it usually causes respiratory infection, from the common cold to serious illness such as middle respiratory syndrome or MERS and self-acute respiratory syndrome or SARS, a new type of coronavirus that was discovered in humans since the outbreak occurred in Wuhan, China in December 2019. In my presentation today, I will talk in six parts, which is the first part. I will talk about what does the coronavirus spread. Second is about what are the symptoms of novel coronavirus. That is about how can I avoid the risk of infection. Fourth is about should I wear a medical mask. The next part is about what should I do if a family member displays symptoms. And the last part is about does the novel coronavirus affect children? Okay, let's go to the first part, which is how does the coronavirus spread? The virus is transmitted through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing, and touching surface contaminated with the virus. The virus may survive on surface for several hours, but simple disinfectant can kill it. The second part is what are the symptoms of novel coronavirus? The symptom of novel coronavirus is fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal. The symptoms are similar to the flu or influenza or the common cold, which are a lot more common than novel coronavirus. This is why testing is required to confirm if someone has novel coronavirus. It's important to remember that key prevention measures are the same. Frequent hand washing and respiratory hygiene. Cover your cough or sneeze with a fixed elbow or tissue. Then throw away the tissue into closet. Also, there is a vaccine for the flu. So remember to keep yourself and your child up to date with vaccination. The next part is how can I avoid the risks of infection? Here are for precaution you and your family can take to avoid infection. First is you have wash your hands frequently using soap and water or an alcohol-based hand rub. Second is cover mouth and nose with flex elbow or tissue when coughing or sneezing. Dispose of used tissue immediately. Next is avoid close contact with anyone who has cold or flu-like symptoms. The last is seek medical care early if you or your kid has a fever, cough, or difficult breathing. Let's go to the next part, which is what is the best way to wash hands properly? Step 1 is wet hands with running water. Step 2 is apply enough soap to cover wet hands. Next is scrub all surface of the hands, including back to hands between a finger and undernail for at least 20 seconds. And step 4 is rinse thoroughly with running water. The last step is dry hands with a clean cloth or soft or single-use towel. Wash your hands often, especially before eating, after blowing your nose, coughing or sneezing, and going to the bathroom. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Next part is what should I do if my child has symptoms of novel coronavirus? You should to seek medical attention, but remember that the symptoms of novel coronavirus, such as cough or fever, can be similar to those of the flu or common cold, which are a lot more frequent. Continue to follow good hand and respiratory hygiene practice like regular hand washing and keep your child up to date with vaccination. So that your child is protected against other virus and bacteria causing disease. As with other respiratory infections like the flu, seek care early if you or your child are having symptoms and try to avoid going to public place, workplace, school, public transport to prevent spread to others. Next is what should I do if a family member displays symptoms? You should seek medical care early if you or your child has a fever, cough, or difficulty breathing. Consider calling ahead to tell your healthcare provider if you have traveled to an area where novel coronavirus has been reported, or if you have been in close contact with someone who has traveled from one of these areas and has respiratory symptoms. The last part in my presentation is, does the novel coronavirus affect children? This is a new virus and we do not know enough yet about how it affects children or pregnant women. We know it is possible for people of any age to be infected with the virus, But so far, there have been relatively few cases of the novel coronavirus reported among children. The virus is fatal in rare cases, so far mainly among older people with pre-existing medical condition. Okay, thank you.